Hello, I'm Dr. Jonathan Silverberg. I'm a professor of dermatology and director of clinical research and patch testing at the George Washington University School of Medicine and Health Sciences in Washington, D.C. Itch-dominant atopic dermatitis is a fairly recently identified subset of patients, although I think if you ask patients, they'll acknowledge they've been having this for a very long time. This idea really started at a clinical observation that I made 5-6 years ago, but it takes time to study these things. But my interest in this was really from the perspective of we really need to better phenotype patients clinically and to really try to figure out what's the best way to match the right treatment to the right patient. There's certainly lots of very interesting translational research looking at sort of expensive and sometimes invasive endotyping exercises and biomarkers, etc. But I wanted to see, is there just a simple, feasible clinical way that we could all just look at our patients and maybe stratify and identify different subsets? And so we did a very simple clinical phenotyping exercise. We said, well, what if we just take two sort of domains, if you will, for the disease? Let's look at lesional severity and let's look at itch severity. And let's just divide that up into two groups, mild to moderate itch versus severe, and then mild to moderate lesions versus severe lesions. And then see if we look at those four different combinations, are there differences in those subsets of patients? Not surprising, the majority of patients that we see are going to be in that mild to moderate itch and mild to moderate lesions. Those would be patients, I think we'd all agree, are more on the mild side of things. And then, of course, there's a subset, fortunately, the smallest, or one of the smallest subsets, would be severe itch and severe lesions, right? Those tend to be the worst of the worst. But between 25 and 35% of the patients that were coming through our practice setting met this criteria of mild to moderate lesions, but severe itch. And this, we coined the term itch-dominant atopic dermatitis. It's not to say that their skin is all clear or that this is just itch with no lesions. On the contrary, they have atopic dermatitis lesions, but the lesions don't look nearly as bad as the itch is being reported by the patients. And this is not a rare phenomenon. This is something that comes up quite a bit. So there's a lot of important ramifications of the itch-dominant atopic dermatitis patient. First and foremost is, if you're not asking about itch, you're going to totally miss it, because this patient population from the outside looks mild. And even I, as a clinician who was treating these patients, was missing it. I saw what looked like mild lesions. If I wasn't asking about their itch, I would have totally missed the fact that these patients were doing very poorly, weren't sleeping, terrible quality of life, and they were not getting an adequate response to topical therapy and ultimately needed a systemic therapy. So ask about the itch, because otherwise you're not going to identify the subset of patients. Now, the second consideration is, once you identify the subset of patients and you see this patient really does seem to have this itch-dominant AD, they've got mild to moderate lesions, they're using topicals, maybe they're getting some response, but the itch is off the charts. And in that scenario, at that point you realize they're probably not going to be getting an adequate response with topical therapy alone, because what are they going to do? Treat the whole body, head to toe, 99% BSA with topicals every day? That's just not feasible, nor is it safe, nor do the medications even come with sufficient quantities to do that topically. So at that point, you're thinking, I need to step up to an oral systemic or a biologic therapy to really more holistically or systemically treat that itch. And one of the benefits of that is it might have a steroid-sparing effect, reduce some of their treatment burden, but first and foremost is it's going to be necessary to achieve adequate control of their itch.